get with a cardiologist and go back home. And I did. They did a stress echo, said there's nothing wrong with my heart. So that was 3 years ago, went on blood pressure meds, eventually got that figured out, and my blood pressure came down to a more normal level. It's just strange because nobody could figure out exactly what was going on. There were a couple other symptoms. So, and then about a year ago, last year, I started noticing my blood pressure creeping up again. And I had actually lost even more weight last year. So I wasn't sure what was going on, and went and based on the recommendation of a client who's a pharmacist, he says, you know what, Joe, sometimes the stress test can't tell everything. I would recommend getting a CT scan done. Calcium scoring test, I guess is another word. So I did. I just chose to do it, and I'm glad I did. The funny thing is because I requested it, the doctor's office, and it was a new physician, a new primary care doctor, they didn't even really look at it. And in fact, I checked up. I said, so did you guys get that test? And they said, no, I don't think so. And the next day I called them and said, yeah, we got it, but we haven't had a chance to review it. And a third time I said, is there anything I should know? I said, well, when we review it, if we see a problem, we'll call you. And end of the story was they didn't call me. And I kind of thought nothing was wrong. And then maybe it was just a waste of time and money, which, by the way, the CT scan, a lot of insurance doesn't cover it, but it's cheap. I ended up about 3 months later having some blood work done. And I said, by the way, can we review that CT scan when I'm in? And they said, sure. So I went in, and the nurse practitioner saw me, and they looked at the numbers and said, oh my gosh, there are 1,100 on this score. And as I understand it, a 400 means there's pretty significant blockage. So needless to say, I was a little upset. And so they sent me to a cardiologist. Cardiologist did a EKG and ordered a stress test. Said in that they could see some damage to the heart, but all he wanted to do is put me on statin drugs. And I'm not a big fan of the medicines, and certainly not statin drugs. So I was kind of like, what's going on here? And I remember thinking at the time, I kind of read up and knew some of the steps would be maybe an angiogram or something. Fast forward to early this year, I ended up in Chicago, started noticing again, blood pressure is still rising, a little less energy and that sort of thing. So saw another cardiologist here who promptly had the stress test done, confirmed everything else that was said, did an angiogram with the idea of putting stents in if something could be done. The physician said too much blockage, and we scheduled a quadruple bypass surgery, which kind of crazy. The thing I look at too, and I'm sure you as a doctor would recommend this, is nobody's going to care about your health as much as you do, and you got to be proactive. Getting the CT scan was key. I wouldn't have known probably, because I didn't have a lot of symptoms. I had a few. No chest pain at all.
Wow.
So I'm glad I did it, although the idea of having someone cutting you open, from here to here is not exactly exciting, thought.
Yeah. And so you never had symptoms before, and 3 years ago the heart they did a stress test and it was negative too, huh? Or it was just a treadmill,
or any heart damage 3 years ago. They did a stress echo, and I understand there are different versions of the stress test. This last one was what they call a nuclear stress test.
Right.
I get dye in the arteries, and they can see a little more clearly. But the one we did last year when I was still in Kansas City was similar test, and they could see some damage, but for whatever reason, that particular cardiologist didn't feel like it was necessary to do an angiogram. When they went in and actually did it, Andres, they found one of the arteries almost totally blocked, another one about 90%, and all of the arteries had blockage of at least 60%. And so that's why the stents were never done, because two of them are just too blocked. Now, the good news is I had no chest pain. They didn't have to schedule, or we were able to schedule a surgery versus, how a lot of those end up. Unfortunately, people don't get any symptoms, or maybe they're unaware or not paying attention, and then they end up having chest pain and rush to the ER. So I didn't do that, unfortunately.
Yeah, that's awesome. And when I hear you say like that you've been losing weight and everything, one of the things at the hospital that I see a lot is like when patients start like getting fit, losing weight, and things happen in the body. And so then they tell me, well, I'm doing everything right. Like this is happening because I'm getting fitter, because I'm getting healthier. And so, right. And so how did you, how were you thinking through that, and how was that for you? And how did you think that this kind of prepared you for the surgery in a way,
Well, it's interesting because the first thing I kind of own is when I was in my 20s and 30s and 40s, I was eating whatever I wanted. I worked out pretty regularly even in those days, but I remember when I hit my 40s, I started putting on weight, started not feeling as good. And, like I said, I started to realize that I had to be more proactive with my health. So I was up almost 200 pounds back in about 20. I lost about 30 pounds of that that year. I kind of slowly added some of it back on. Last year I dropped about another 25 pounds again because I creeped up to about 190 and brought it back down. The thing is, I realize is you can eat healthy and you can exercise, but if you have that past where you didn't do that, that's where the blockage came from, I think.
Right.
And I've done some research on it too, reading, and I guess a lot of it's the calcification in the arteries. It's not necessarily even the cholesterol from what I'm hearing. Mm-hmm. It goes against what most of the medical community thinks. I think, though, it made a huge difference in recovery because, they make you walk. Like I was still in the ICU and they're making me walk. That it was almost a day out. And then every day while I was in the hospital, I was there for 5 days, they made me walk. Well, the first couple of times I didn't go that far. The first time I did it with a walker. But after the first time, I was like, no, I'm steady enough. So they let me walk. I walked the entire floor, and they said, oh, you're really doing good. Some people can't get this far. And the more I thought about it, I figured, you know what? A lot of people are obese. They are maybe older than I was too. And if they can go 10 feet with a walker, they might be doing good.
Right.
And then since I've been out of the hospital now for 3 weeks, they said, no limits. We want you to walk as much as you can without, hurting yourself. And I'm big about paying attention to your body. So I got a Fitbit that I decided to track what I'm doing. So I walk about, on average for the last couple of weeks, about 15,000 steps a day. Not all at once.
Right. Joe, and how was the process? Like, it was interesting. Like after the Tony Robbins event, and how was the what made you lose the weight? What do you think helped with that? Like, I've been to those events too, and like, for me, they've been really useful in so many different ways, and helpful and so on. And for you, what was the one thing that said, okay, about, with losing the weight and everything?
I think there are a couple of things. One is I was sick and tired of not feeling well, sick and tired of being sick and tired, as I said. And I think the other thing is just remembering where you want to be and being in the right state of mind. There were some things I think that were disempowering me in my thoughts. And there were a lot of shifts that happened way past the physical changes. but I learned a lot, going through that. I've been to several events. I've crewed some events now, and I know that it can make a huge difference, just your mental, emotional framework, your physiology. And then as you start walking, that sort of thing, you begin to understand, or not walking, running, exercising, whatever, you get healthier and healthier. You feel better and better. I think I'm actually writing some stuff. Got a lot of time on my hands.
Yeah.
So I'm going to write a blog. I've gotten a number of articles I've already written, but I haven't published anything yet. It'll be out before long. But one of them is called The Reduction to the Ridiculous, where you figure out some small denominator that you can do every day. So like for me back in those days, I remember thinking, I got to do something. So I got on the floor and I struggled to do 10 push-ups, which that was never a big thing. I was a college wrestler. And I was working with a coach at the time, an accountability coach, not a Tony Robbins coach, but she wanted me to work on health and other things, and then she made me track it. So I started doing 10 push-ups a day, decided to do that every day, and then at the end of the week, we'd meet virtually and talk about the things I accomplished. Well, one of those things, so I did 70 push-ups the first week. The next week I did 11 a day. The next week I did 12 a day, and eventually got to where I was doing 100 a day, which if you do the math on it, and I was so consistent, it taught me a lot that if you break it down, it's like even my walking right now. I'm not doing 15,000 steps all at once. I don't think I would pull that off. Probably pass out. But I get up in the morning, I walk to a coffee shop, I sit down for an hour or so, I write, I journal, all of those kind of things. So I think it definitely made a difference. One thing I wanted to mention to your listeners is one thing that I helped, because I do believe in mindset. I've been a fan of hypnosis for a long, long time. And in fact, I have some friends that have been through some of the Tony events who are hypnotists, but I read research that says it can assist in the recovery process. So that's another thing when it comes to mindset is anybody who's not been through an open heart surgery probably don't know the nuance. None of us do until we go through it. I remember reading something about this guy saying, yeah, I could hear my heart, and I was worried about if something was going wrong or right. You're more tuned in, more sensitive, right? So I basically thought, I don't like this. It doesn't sound good. And you go through a lot of issues, like if you cough or you sneeze, because your sternum is where you're cutting to, that hurts. It still does, even, almost 4 weeks out. They give you a little heart pillow, and squeeze that if it's close by. But the hypnosis actually helped me calm my mind down before the surgery. I think, frankly, I was very relaxed going into it because the hypnotherapist had me listen to the recordings several times in advance of the surgery and then after the surgery. And even little things like, every doctor's going to tell you what those risks are, right? That small percentage. And she says, in the recording was about, you're fit, you're healthy, you're not carrying all this extra weight. So all of these things, that's very, very low risk for you. That's probably not going to happen. You've got this. And so all of those things prepared me. And I think the biggest factor in my recovery is I've had very little pain. I was off of the heavy narcotics after a day and a half, only time. And I really believe that's true.
Yeah, one of my good friends, when I first started doing meditations years ago, the guy who taught me meditation was this guy who was a nuclear weapons specialist for the UK. Yeah, pretty interesting guy. And then he had an open heart transplant by Dr. Oz in New York City. And he used to always tell me that the main thing that helped him was hypnosis. He would, going through all these surgeries, all these procedures, he would really, that helped him so much, and I think for me, yeah, hypnosis has been really powerful in meditation, and of course, but yeah, hypnosis. And so the way that you did it was somebody talking to you before you went through surgery, or did you have the tapes already, or did they record them for you, or were you doing a
What
program?
what this therapist does, she actually hypnotizes you in her office and she records that session and then she sends you the recording via Dropbox to listen to. I've done another session since then about other things. And I've been hypnotized numerous times. I know there's a power and it kind of takes you
Yeah,
out of that different state, relaxed state with the ability to suggest. So it was extremely helpful. Like I said, most of the types of things that I've had have been because of what they do. They take a vein out of your leg, so because they remove it, there's some like tingling or numbness in the leg as well as on this in your chest. There's some as well because apparently they remove the mammaries, which I didn't know they did that.
yeah.
So I can even still today feel this where it's tender, but pain-wise, not so much.
Hmm.
And I am so blessed and fortunate that, I had to pay for the session. A lot of people go with whatever they're told. I'm not like that.
Right.
I will contest. That's why the one cardiologist back in Kansas City and even the one here, I said, I don't really like statin drugs. And they said, yeah, but that's the way it is. It's the best way. I says, does it reduce the blockage? Answer, no. So why take them? Well, because it reduces the buildup going forward. And they really can't say affirmatively. So I still debate that whole issue.
Mhm.
I'm not telling people not to follow their doctor's recommendations, obviously. But I do think you have to be proactive in your own health care. Nobody cares about what you do.
Yeah, I think so too. And I mean, and statins that's a can of worms, really. I mean, the biggest claim is that it does reduce mortality. That that people live a little bit longer, and that somehow there is an unknown mechanism to reduce the damage in the vessels and so on. But there is studies that show that that it that depending on the side effects are pretty bad from it for many people, and other things can work as well for the same issues. And really, in terms of like focusing on reversing heart disease, I don't know. Have you ever heard of Dr. Ornish? Dr. Dean Ornish, yeah, right? Yeah. And so his data is like the best. I mean, talking about reversing heart disease and 20, 30 years of studies and how to do it, and so it's interesting because you're implementing all these things and your recovery is so good. um, it's been really good, and so that's great. And another thing that comes to mind is there's this thing called the childhood adverse experiences. There was a guy, and so it makes me think of Tony. Like when people go to Tony's events, a lot of times they end up losing weight, and how related it is, that the stuff that we don't think that is even like, you can eat kale all you want, but if you haven't dealt with some of the issues that have been coming up on and on, then it's really hard to lose that weight. Or did you find that that helped in a way? Or I guess what I'm trying to say is that a lot of times we can look at diet like, okay, what's the perfect diet? And but we forget about the primary nutrition, which is like our career, our spirituality, our traumas, all these things that really are the things that are holding us back. Did you kind of find some of that, or how?
Oh, I think everything is related. That's the thing. If you go see a heart doctor, they talk to you about your heart and they're experts at it without question. And if you go talk to an orthopedic surgeon, they're an expert with, the bones and joints.
but it leaves out nutrition. And, you know, in all fairness, and it's like you, but it is not an area that doctors are trained in significantly, correct?
I don't know.
And but the other things like the spirituality, meditation, some of these things are alternatives. Will it work for everyone? I don't know that it will. But that's where the experimenting, the open-mindedness to it, because I've had conversations in the medical field, nurses and stuff that tell me that, you know, you need to listen to your doctor. I need to go with the program, but I'm just enough of a maverick at this stage in my life, not so much when I was young, that I'm going to challenge those thoughts. I'm not going to buy what somebody told me as the answer. It doesn't mean I disrespect their knowledge or their training. I mean, my God, doctors go through a lot of education. My question is, do they give them enough of the stuff that can help them far past just what a medicine or a drug is? Well, I think it's definitely made a difference. And, you know, and then the other thing, when you go into this, like I said, you can get worried, like, oh my gosh, they're going to cut me open. Just this thought alone is starting to freak me out a little bit.
I bet.
I actually happened to see a TV program that I wasn't watching, but at the time it was some medical program, and the guy was having open heart surgery, and they're I'm like, which isn't even realistic, right? You're out. They got you so drugged up, you don't know. And thank God for the anesthesiologist, because I don't know how that would be, but I know that I kind of set it aside. The hypnosis helped me calm down, not think about it. And in general, the more I thought about it, you know, you're going to be fine. You're going to be fine. And, you know, if you're not, then you're not here to worry about it.
Right.
So there was no reason for me to get too excited about it. And then coming out of it, yeah, I mean, I'm still like, when am I going to be able to drive again? You know, stuff like that. But everything is one day at a time, and I'm utilizing this time for other things.
Yeah, definitely. And any insights like from the surgery that you were not expecting, like realizations, or you know?
I think, like I said, as much as anything, I'm grateful that I was proactive about my health, doing the CT scan on my own, the hypnosis on my own, those things. And I think the other thing past all of that is, you know, we only get one life to live. So it's been a good time of reflection for me. Like I said, I'm writing and journaling every day, thinking through what I did that I could have changed maybe, and I can't today, but I can continue to eat reasonably healthy going forward, still live my life. I'm not saying people should give up everything and become a vegan, and I'm not, nor do I plan to be. But however many years that I have left on this earth, I have a chance to do some dynamic things, and I intend to. So that's the good thing about having lots of time on my hands.
Yeah, that's great, Joe. And what's next for you? What are you thinking? You mentioned some writing and stuff.
Yeah, I'm going to be publishing a blog. For a long time, I put off something that I think that is really in my heart, and that's forever. I've been a coach at heart, but I always put it off because I said, you know what, the people that are out there doing that, I don't see any of them making any money. I don't see them doing this or that. But, you know, the one thing I started realizing, yeah, you thought of 1,000 reasons why not to do something. So I've decided that I will begin my blogging. I'm a good writer. I have some insights that I think can help people. And I'm excited to get that started and published. It won't be perfect, you know, it won't have all the fancy on the website, but the thoughts will be there. And just getting started, that's the one thing when I look at heart surgery. It could be anything. You could die in a car accident tonight on the way home. You know, how many people die with their dreams locked up inside of them. So that's the big thing. Is I'm going to be doing some coaching. I'm a life insurance salesman. It's a good profession. I don't intend to quit doing that. It provides my livelihood, but I intend to do some other things as well.
That's exciting, you know, and yeah, and it's so crazy that like when they do the studies with the blue zones, when they looked at people who were working on something that was purposeful for them, that adds about 7 years of life, statistically, you know, and so I mean, I think that's such a big part of our heart health or our health overall. Just like doing something that is within what they say is like our genius. They say it's like the word genius is like our. I think when you look at the root of the word, it means um, our spiritual authenticity. You know, and so it's like when we're in our genius. You know, like you say, you're a coach at heart, and so it's like it seems like when we do that, we check in for longer here. You know, and so. That's great to hear, and looking forward to seeing what you know, keeping in touch and tracking you as you go along with all of this.
Yeah, I think it's cool what you're doing. So.
Thanks, Joe. Thanks, appreciate it. Any I think that's pretty good. Any last thoughts for people who are listening to this, you know?
Like I said, I said this message before is be proactive in your own, and I, instead of saying health, I'll say well-being, because it does tap into what you're saying, and what we both agree on is that mindset, spirituality, there's a whole thing we didn't touch on, a heart math, and I can think of things the way I grew up that probably have influenced me, have even made me think, I wonder if there's some way that I created the blockage. I think we're creators of so much, in both positive and negative. For everything we've ever done positive in our life, we created in so many ways. And for everything that's maybe less than perfect, we probably had something to do with it too, even though that was a little woo-woo for me a few years ago. But now today, I really believe you got to embrace every part of your being, which is the mind, the heart, your soul, as well as your physical body. So that's the only thing I would say is just pay attention to all of those things. That's your well-being.
That's awesome, man. Well, that's great, Joe. Thank you so much. I learned so much from this story, and keep in touch.
Absolutely. I thank you for having me on.
Oh, yeah, for sure. Thank you, Joe. Appreciate it.
All right.
Okay, take it easy. Bye.